Hi everybody, this is Dr. Britt Talley Daniel, a neurologist in Medical City, Dallas, Texas. I've written a book that's published on Amazon in my 3-volume Mini Neurology Series, which is just a series of short books on common clinical neurologic problems. And the book I'm talking about is the third in the series called Panic Disorder. I'll show you a picture of the book here. And you can get that book if you have Amazon Prime for free as an ebook or a print book by going to Amazon, the book website, and then enter my name, Britt Talley Daniel, and all my books will come up. Then just click on it and get it if you're interested. Panic disorder is one of the 4 anxiety disorders that's listed in the DSM-5, which is Diagnostic Statistical Manual, 5th edition for the American Psychiatry Association. They abbreviate that as APA. The panic disorder did not get into the psychiatry textbook until 1980. That was the 3rd version. So physicians such as myself, who were educated in medical school and took some rotations on psychiatry before that, as part of your normal medical student program, were never educated about panic disorder. And it's still an unusual problem, but in my practice with a high incidence of migraine patients, I see it 3 or 4 times a week because I get referrals from our emergency room, and a lot of those folks have had panic attacks, gone to the emergency room with a bad headache, like a migraine, and there you are. So panic disorder and migraine are associated comorbidly, which means they come together about 40% of the time. So in the chapter under anxiety in the psychiatry textbook, there are 4 anxiety disorders, and the first one is generalized anxiety disorder, which is abbreviated GAD, panic disorder, and the 3rd one is post-traumatic stress disorder, and the 4th is social anxiety disorder. My experience of understanding where the word panic came from after I was fortunate enough to go with my family to the Holy Land, touring with the Franciscans there. And we had a free day in Jerusalem, and right across from where we were staying was one of the Dead Sea Scrolls museums. So on the way into the museum, there were some stanchions outside for education purposes, and that said on this little educational thing outside the museum, it said that our word panic came from the Greek god Pan. So I came back to Dallas years later and I started thinking about that. Who was Pan? So to the Greeks, who was a type of a religion, a pagan religion that existed in Greece before Christ, so before 2,000 years ago. And there was what they called Pan, who was a satyr, who was a demon, who was the god of the forest. And the word Pan, P-A-N, comes from P-A-I-E-N, which is a Greek word that means pasture. So he was the god of the forest and lived there. And his appearance was one who had horns, a beastly body, like a goat. He had a cloven foot, which has always been associated with Satan. And the pictures of him that are in history books show him playing a pipe in the forest, or always lurching after women. He was always trying to get women and seducing them. So the Greeks experienced the same things we call panic symptoms then, but they thought it was related to sort of a demonic possession by Pan. Now, the Greek religions were pantheistic, means they had multiple gods, and they sometimes had a god that was assigned to a certain place, like Hades was the god of the underworld, Zeus the god of heaven, Poseidon the god of the sea, sorry about that, and then Pan was the god of the forest. they had built a church in a place that's called Canyon Springs, which is located 26 miles north of Capernaum, which is at the very north edge of the Sea of Galilee, near where the Apostle Peter lived. We were able to go to that spot on our Holy Land tour, and when the Romans took over that area from the Greeks over 2,000 years ago, they named it Caesarea Philippi. And that's the place in Matthew 16 where Christ went with his apostles, Caesarea Philippi. And that's the spot where the church was formed on Peter. And the Greeks thought that at the spot Canyon Springs, there's a bluff of limestone, and there was a church there, and you can still see the borders of the church in cement. And there was a stanchion carved out of this limestone wall where Pan's statue was situated. It was about 8 feet tall, but that's not there anymore. And there was also a river that came out, which was one of the 3 branches of the Jordan River that went down to Jerusalem. And it had a deep area there called an abyss. And they would take the Greeks would take their sinful persons up there and drop them in the water in this abyss, and they couldn't hear them hit bottom. So the Greeks thought they were standing at the gates of hell. And when Christ chooses Peter, he says, the gates of hell shall not prevail against the church that he was standing at. And so Christ knew where he was, that he was standing at the Greek former spot where Pan had been worshipped, and he was starting a new religion, Christianity, at that spot, which I think is a very interesting statement. Now, according to the psychiatry textbook, a panic attack can have 13 possible symptoms, and the doctor needs 4 of them to make a certain diagnosis. And the way they work it is, if someone has a couple of panic attacks, and they're brief and they're recurrent, maybe 2 or 3 more, then they start calling it panic disorder. And this usually starts in persons in their early 20s, between 20 and 25 years old. It can be a chronic psychiatric problem. And as I mentioned, it's comorbid and kind of goes together with migraine. Now, I'll show you a picture of the 13 panic symptoms. And they are things such as a rapid heartbeat, trouble breathing, sweating, trembling or shaking, nausea, dizziness, lightheaded or faint feeling. They can have numbness and tingling around the lips typically, which is called circumoral paresthesia, or in the cheeks on one side, face, hands and legs. It can be one side or both sides. It can also be a chill or hot flush feeling. And then there are 3 pure psychiatric symptoms that don't really have any good pathophysiologic reason why they're occurring, which are being kind of zoned out, like in a dream where you're spectating and maybe looking at yourself like in a movie, feeling like they're losing control of their body, or feel like they're dying at that moment. They ought to go to the emergency room. And actually, something like half of persons who have their first panic attack do go to the emergency room, where they're usually checked over carefully, given an IV, maybe some medication for sedation. They'll have an EKG if they're having a headache. Many times a CT scan is done, a blood count and electrolytes and things like that. And usually the tests are all normal. And the patient then, after that visit, is sorted out to see a cardiologist, usually to check out their heart because they're having palpitations, and then also see a neurologist for headache. Now, adrenaline discharge can happen during a panic attack. It turns on the fight or flight response. And so you can correlate some of those symptoms with, like an adrenaline discharge can give you rapid heartbeat, trembling. You can have sweating, which is an autonomic sort of a discharge. We sweat with anxiety or nervousness, and we sweat when we're hot. There's a popular figure of speech. We'll say, hey man, no sweat, I can do that, which we mean I'm not going to get anxious doing this act, whatever it is, something I don't want to do, and I'm not breaking out in sweat. And so there's a common statement, but Sweating can come with anxiety or nervousness or with athletic endeavor. Um, when a patient has a panic attack, it's a frightening thing. And they usually come on suddenly. They usually come for no reason. They come out of the blue for no reason. The psychiatric literature of panic disorder patients has found that 6 months before the event occurs, they're stressed to some way or another, like divorce or moving and losing a job or having final exams and terms and tests like that. But there's no actual event at the moment the panic attack occurs for many people. There can also be events that occur in the middle of the night, such are called nocturnal panic attacks. And so again, they originally come out of the blue for no reason. So when the patient has all these symptoms and they feel terrified and having all these problems, they don't associate it with any psychiatric problem because they don't have anything going on psychiatric at that moment. That type of event usually relates to anxiety, where somebody's really nervous. Like if I live on a busy street and if I take the trash out and back and somebody's there is going to shoot me with a gun, well, that'll make me anxious and I have a reason for overbreathing and for a rapid heartbeat and adrenaline surge and that sort of thing. But if I'm just sitting in a movie or driving a car in traffic and I get those symptoms, I don't understand it and I can't relate it to anything that's happening in my life. And so that's something that needs to really be carefully explained to panic attack patients, or otherwise they won't get it. So there are 3 pure psychiatric symptoms, and the other 10 events are really coming from altered physiology, normal physiology. The other thing about panic attack patients, or panic disorder patients, is most of them are pretty chronically overbreathing, hyperventilating. And so if a normal person, whatever that is, let's say a 30-year-old adult man, if he's going to breathe 10 or 11 times a minute just by sitting around in a chair at an office, that's normal. But panic men will be breathing 11, 12, 13 times a minute, but it's not obvious. When I was an intern at John Sealy Hospital in Galveston, Texas, in medicine in 1970, I would work all day seeing patients, making rounds, and I'd go to work in the emergency room at 6 o'clock in the evening and get off at 6 o'clock in the morning. And I'd probably be somewhere off in the emergency room at 2 in the morning, suturing up some laceration in a room with a nurse helping me and things like that, when all of a sudden this hyperventilation patient would come in and hit the doors at 2 in the morning, and they'd come in pretty obviously overbreathing, and the nurses were very adept in knowing what was going on and put them in a chair, usually start an IV. I would come over and check them over quickly, sometimes give them a shot of Valium or something like that in those days, and I'd finish doing my lacerations and later come back and take a history and they'd be calmed down a little bit. That's a pretty dramatic presentation of hyperventilation. But panic attack patients can do that, but they also may just have subtle, mild hyperventilation 14, 15 times a minute, and it doesn't look obvious to anyone. But if one does overbreathe, you blow out your carbon dioxide, you bring in oxygen, so it changes your blood gases to be more alkalotic, and that's a serious thing because it makes your peripheral nerves metabolism change, so they'll fire off more easily, so you get numbness and tingling around the lips or in the fingers or your legs. It also makes you feel sort of dizzy. So the symptoms, the 10 symptoms panic attack patients are having that relate to altered physiology are real, and anybody else would get them in that situation, but they just come out of the blue for no reason. The 3 psychiatric symptoms can't really explain them other than that's what happens during the event. You could have a panic attack patient that may have 6 or 7 of the panic symptoms with an attack, and they'll have another panic attack and they may have 8 symptoms, and some of them are different, so they don't have to stay on the same symptom with every attack, which is important. I have a little sheet in my office where I can document and check off the symptoms panic attack patients have. I have the 13 symptoms listed there, and then I can see them another time and they may have a little different group, but they're still having panic attacks. So the next thing would be that the panic attacks, the symptoms come from altered physiology mostly. That's what brings patients in. And then what can happen after that is hard and difficult. So after these terrifying panic attacks, patients are frightened to get out of the house. They just want to stay home. They don't want to go shopping or go exercise or even go to work. And that can be associated with what's called agoraphobia. So agoraphobia, which is fear of crowds or being out, can come to certain persons who have panic disorder from panic attacks. And it's just the frightening terribleness of it makes people want to do that. All right, what if you were to do tests to work up panic disorder? What do you find? So generally these people would have probably an electrocardiogram, chemistry panel, CBC. If they're having a headache with it, or sometimes even without it, we'll do a CT scan or MRI scan of the brain just to be sure they're okay. Many times they may see a neurologist, have a neurologic exam, which is balance and coordination for walking, function of the hands for strength and movement, checking out the eyeballs, the pupils, the movements of the eyes, looking in the eye with an ophthalmoscope, checking their carotid arteries, listening to the neck, checking their pulse and blood pressure, striking the arms and legs with a reflex hammer to see if their reflexes are okay, and checking them with things like pin and vibration of their body, see if their sensory exams are all right. And so that's a neurologic exam, which should be normal with panic disorder patients. If they're seen in the emergency room and the doctor were to get blood gases, sticking a needle in an artery in the arm, for instance, the blood gases will change with hyperventilation during a panic attack. So normally the acid-base balance, which in medicine is called the pH level in the human body, is normally 7.4. And if you have a heart attack and quit breathing, it'll drop 7.3, 7.2, 7.1. It gets that low and you're not revived, and you're usually probably going to die. But if you overbreathe with hyperventilation, it changes your blood gases to become more alkalotic, so it'll go 7.5, 7.6, or something like that. And that's probably the main positive thing that's found in terms of lab analysis, usually in the emergency room as an acute evaluation type thing with panic disorder. Other tests are usually normal. There's a lifestyle to live with panic disorder, so how would one treat it? First, I would have them do a lifestyle. Have them have good regular sleep pattern, to be careful with the use of caffeine or stimulants like Sudafed or any kind of supplements that have Sudafed or caffeine in it. And the problem with supplements is they don't always list honestly what's in them, and so you don't know. So the FDA has instructed doctors to tell patients don't buy supplements. So caffeine, a lot or huge dose of Sudafed can aggravate rapid heartbeat and make you feel like you're going to have a panic attack. Patients are advised not to drink any alcohol at all if they have panic attacks, because alcohol is a short-term sort of a tranquilizing agent, which will shut down the anxiety part of the brain, in the brainstem, the part that sets off the autonomic nervous system. But when it shuts it down, it comes back and releases it, and it's worse. The attacks are worse than before. And so short-term acting agents such as alcohol are really bad for panic attacks, and patients are advised not to drink at all if they have it. They should exercise aerobically. The American Heart Association instructs that everybody is supposed to do 3 or 4 minutes aerobic exercise would get your heart rate up a certain level for 20-30 minutes in a week. And everybody should do that, and that's very helpful for treating things like this. It's helpful not to overwork. The American Psychiatry Association designates anybody who works more than 5 hours a week as a workaholic. And that's not healthy or good for you. It can make you not sleep well, and it's pretty boring in terms of relationships and knowing what's going on in the world. And people need to get a life and have hobbies, a relationship, worship their faith, spend time with family, and that kind of thing. Okay, medical treatment of panic disorder. First, you consider putting the patients on a serotonin receptor inhibitor drug. Those are drugs that raise serotonin, and serotonin is a calming thing in our body. They generally have very few side effects. The ones that are listed as approved by the FDA are Zoloft and Lexapro, and those can be given by a doctor and monitored. Many times we'll start the patient off thinking we'll treat them for 4 to 6 months. If they have more trouble after that, sometimes they're left on indefinitely. The doctor could use short-term benzodiazepine drugs such as Xanax or Klonopin. These are drugs that work to quieten the autonomic nervous system, the anxiety center of the brain. They are class 4 narcotics. You have to be careful in using them. But for instance, with Xanax, which is abbreviated as alprazolam, the generic, the way most doctors are writing it now, you can use a small dose. This is 0.5 milligrams, and use it every 4 hours or so. You can get maybe 60 tablets in a month, and the patient may take 1 or 2 a day during the week. They worry about addiction, but the addictive level, according to the Federal Drug Administration for Xanax, is 4 milligrams a day for a month. And so the patient would then have to be taking 8 of the 0.5 milligram tablets a month to get hooked on them. I don't use that drug, and many physicians are very cautious about using them, but yet they're approved by the FDA for treatment of anxiety and panic disorder. The other thing the patient can learn is a skill called cognitive behavioral therapy. That seems to work better than regular structured psychotherapy, where you kind of go back with your parents and your education and all the good and bad things that have happened to you in your life and talk to a counselor or a psychiatrist about them. Cognitive behavioral therapy is a skill which you sort of substitute in your head certain sentences that are more peaceful and anxiety relieving than to have bad thoughts in your head. Like many persons that have a panic attack, they're going to think, oh my God, I'm having a stroke, I better get to the hospital quick, what's happening to me? And their thoughts are racing, and they're usually bad, negative thoughts. Once they can be educated about it, they can control breathing on their own a little bit, or maybe take a little Xanax or Klonopin at that time to treat, they can think more peacefully about it. So we're taught that we learn our language with emotions and sentences. We learn those from our parents, school, education, teachers, and we have these thoughts that are in our head, and to a cognitive behavioral therapy, we have to sort of redo the thoughts to not be so anxious. And that can be taught on YouTube by going into the search engine of YouTube and Googling, but just entering panic disorder and CBT, and it'll bring up a series of movies written by healthcare professionals that can be helpful, some of them 5 minutes, some 30 minutes or so. Those can be watched and rewatched. They can also see a counselor or a therapist. It can be helpful to learn how to do CBT. So, I'm going to close this up on my discussion of panic disorder. If you want more in detail, check out my book. Good luck to everybody who has panic disorder, and hope your attacks stop. And God bless all of you. Good luck.